Hi there, my name's Tim Mulholland and I'm a podiatrist at Pride Plus Health. This video is for you if you found out that you were low risk of diabetes foot complications and you'd like to learn a little bit about what that means and what you need to be doing to look after your feet. Let's dive into the three big topics: circulation, sensation and lesions. So when we are low risk of diabetes complications, it means that we've got good circulation. Circulation is the way the heart pumps the blood with all of those nutrients down to the feet. We need to get those nutrients down there because that is what ensures that our skin grows, our nails grow, everything stays nice and healthy. On the inside, it makes sure that we get enough nutrients to the bones and the muscles to keep them strong so that we can stay active on our feet without complications. It's also about the blood returning back to the heart, so we're not getting significant swelling as things build up down there, which can cause problems itself. Next up, there's sensation. So sensation is the gift of pain. We need to feel what's going on with our feet. If we don't, if there is some nerve damage, say we had a stone in our shoe, or we had a little bit of rubbing on the back of a brand new pair of thumbs or slippers or sandals, we wouldn't know that there are some problems occurring. We wouldn't know that because we wouldn't be able to feel it. So when we are low risk of complications, we know that our sensation is intact. And some of the testing that your podiatrist will have done using various things, monofilaments, tuning forks, and maybe an Ipswich touch test, will be able to tell you if you've got good sensation and if there are any other little changes around them. Finally, lesions. When we're thinking about foot lesions in related to diabetes complications, the big ones are corns and calluses. These are pressure and friction-based lesions. When we have any extra movement on our skin, that friction and pressure can lead to breakdown. If it's just a little bit in a small period of time, it can be a blister. If it's consistent in the same area, we start to develop first a bit of protective callus, which a small amount is pretty good. If that continues to build up, however, it can become quite sore and you can get deeper lesions. You can get ulceration occurring underneath it. Same with corns, much more focal areas of callus, that extra hard skin. So it's important to know that when we are low risk of complications, we have minimal lesions, we have good circulation, and we have good sensation. So what can we do about these things? There's a few areas and a few teams that can help us out. Firstly, at home. Now this team might be just yourself, or it might be some other people in your household, some loved ones, mothers, fathers, spouses, daughters, sons, somebody around the house. So there are a couple of key areas to do. We need to make sure when we are low risk of complications, we are still checking our feet regularly. And this is more than just cursory having a look down there. Yeah, I can see it. Checks out. They look good. 10 toes, 2 feet. It's much more about looking for things that are out of the ordinary. So thinking about your normal skin colour and your skin tone. Are there differences in the skin tone? Are there areas where the skin's becoming much lighter or much darker? Is there signs of inflammation or redness? You're also going to be looking for things like cuts and scrapes. You're looking to make sure that there isn't any blisters or anything opening up, which some first aid needs to be applied. It's a really good habit to get in, to check your feet consistently at the same time. It might be when you first get up out of bed, you have a look down there, or maybe it's after a shower when you're looking to pop a bit of moisturizer on. Aim for being nice and consistent. If you struggle to be able to see the bottom of your feet, you can use things like a mirror placed on the ground, or even start playing around with your camera on your iPhone or an iPad. Set that up so you're taking a photo of the bottom of your foot and flick it around and have a look. A few different ways if things get a little bit hard. You've also got the eyes of other people around you. So if you've got a spouse, honey, can you have a look at the bottom of my feet? Yeah, sure. That will be a great way to just keep on top of things and avoid the chances of anything nasty happening there. Next up comes how we look after them with our washing, drying and moisturising. Now, many of us, guilty in the past, used to think that washing your feet was just stepping into the shower, the soap and the water will run down over them. It's really not the case. Particularly when we have got a condition like diabetes, which just raises the risk level of some of those other nasty things happening. So, to wash your feet, it's important to use a soap-free wash with the pH that's the same as the skin, around 5.5. This ensures that your skin is not working harder than it needs to be, and it reduces the chance of having dry, itchy skin. You want to make sure that you're washing the foot and in between the toes as well. If it's a bit harder to reach all the way down there, then you can use things like a bit of a face washer on the end of a stick, or you can get some aids from a lot of chemists these days that can help you reach the bottom of your feet as well. Washing, important to actually give them a scrub, remove the debris. Next up, drying. Your mum was onto something when she said make sure you dry behind your ears and dry between your toes. If we leave moisture build up in between those toes, then we can get tinea and nasty little lesions developing, moisture type lesions in between, which can be portals of entry for some really nasty bugs. Unfortunately, in my time, I've seen and heard of too many people that have developed infections that are putting people into hospital because of simple not drying as effectively as perhaps that they would, if we're being brutally honest with ourselves, say that we would like to think that we would do consistently. So make sure after you've had a good shower, you've washed, you dry thoroughly and you get in between your toes. Finally, moisturizer. We put a bit of moisturizer on our face, we look after that. We also need to look after our feet. We need to make sure that we're getting enough moisture into the skin to keep it soft and supple. We spend a lot of time standing on them, and we also spend a lot of time changing into different shoes and moving around and not being able to see them. So if we can have that habit of consistently every day popping in a moisturizer, and we're not talking something that is really greasy or really thick, we're talking something that's got those nice natural acids that your skin needs. So not a sorbeline. We're looking at things that, we'll say a couple of brand names here, some favourites, some QV-like moisturiser or some Alpha Kerry moisturiser, Cetaphil moisturiser that can sink into the skin and donate moisture and donate those natural acids that our skin really needs. With the moisturiser, you don't want to get that between the toes. Wash and dry between the toes, but moisturiser all the way around the foot, under the foot, the heel and the top and around the ankle. Very important. Next up, toenails. So, if you're lucky enough to be able to reach your feet comfortably and your toenails aren't too thick and gnarly, then when you are low risk of complications, it's a great job to be able to manage yourself. Real sense of independence when we can do those sorts of things. However, if they get a little bit further away, or your hands aren't as dexterous as they used to be, or maybe they're a little bit thicker, then your podiatrist is the perfect person to attend for some semi-regular care to keep those toenails in check. You want to avoid getting any problems, say, from ingrowing toenails, or from, say, the first toenail pressing into the second toe, causing a bit of grief. Next up, let's chat shoes. Podiatrists, we love our shoes, and when we are low risk of complications, it's still important that we make sure that we choose a good shoe that we can lead our healthy and active lives. When we are active, you want to wear your comfortable sport shoes, which are nice and supportive. When we're sitting down and we've got our feet up, kick the shoes off. If you're not going to be on your feet, then it's nice to have something a little bit more breathable. A couple of key features to look for is if you slip your shoes on, it's probably a bit easier to slip over in them. They're not really holding on to you, or they're probably too tight when they're holding on to your feet. So aim to have a shoe that's got some type of fixation via a lace, a strap, a buckle, some Velcro, so it's holding onto your foot so the shoe's doing that hard work and your feet can relax. You want to have a nice comfortable sole, not too flexible and not too stiff. Basically, when you're at low risk of complications, your feet will tell you what is comfortable and we should stick with those. And then it's more about matching up the activities to the right shoes. On those activities, our physical health is so important all of the time, particularly when we are low risk of complications or foot complications from diabetes. Our feet need to get at least 30 minutes of cardiovascular exercise every single day. So cardiovascular exercises are things like walking, jogging, running, pedaling your bike, or going for a swim. Movements where your feet are going to be active and your heart rate is going to lift up a little bit. 30 minutes of that cardiovascular exercise every day. On top of that, our feet need 2 sessions of resistance training a week. What is resistance training? Resistance training is weight training, where you're going to be putting load through your muscles, your tendons, your bones, to ensure that they get nice and strong. Having strong muscles, tendons and bones is more important with diabetes because it also can help facilitate really good carbohydrate, blood sugar management. And it's something that as we get a few more birthdays under our belt, we tend to shy away from. We have these really active childhoods where we play a lot of recreational sports, after school sports, and we've got activities encouraged during the school day. But as we get older, we tend to drift away from that. So if we have diabetes and we have started to drift away from it, it's important to make sure for our foot health and our overall health that we can come back to those things. 30 minutes of cardiovascular exercise every day, 2 sessions of weight training or resistance training for your feet every week. Examples of exercises are things like calf raises, lunges and squats. It's important to load up those muscles in the foot, ankle and leg, as well as the bones and those tendons to keep them really strong. This is the home care side of things. Now let's move over to your podiatry team. So what is your podiatry team for when you're low risk of complications? At a bare minimum, once a year. For some people, that means that once a year we have a little bit of a landmark. Maybe it's around the Melbourne Cup. We know, okay, the horses are running, it's time to go to the podiatrist and have my feet assessed. This is where the podiatrist will do those circulation, sensation and lesion checks, a few other specific things as well, to work out if you are still of low risk. They'll also be using some of these tests to see you might still be low risk, but if we are starting to get a trend and we're starting to see some changes occur. So if that's the case, then your podiatrist and you will be able to pop a plan in place and get some interventions happening there. So that's the bare minimum, once a year. Other than that, we're here for assistance. So if it's nail or skin care that becomes a little bit more difficult because they're all the way down there, or you'd like to have your podiatrist help you out because it feels really good, then come on into a podiatrist as required. For some that's monthly, maybe it's others it's every 2 months or quarterly. Your podiatrist and you will be able to have that discussion and that decision so that your podiatrist is someone who can reach your feet and help you out rather than all of that responsibility being on our own shoulders. It can become quite taxing when you're thinking about all of the things that everybody wants to talk to you about at leading a healthy and active life with diabetes. And sometimes it's nice just to be able to go, oh, Tim, you're the podiatrist. I'll take care of what I need to. You can take care and help me out along that as well. And then there are the other members of your overall health team. These are your supporters who want nothing but the best for you and your best version of your health. So for your feet, there is your podiatrist. For your overall health with the diabetes, you will be really well engaged and seeing your GP on a regular basis as well. They're sort of like the linchpin of your overall care team. Much like the podiatrist is at minimum once a year, having your eyes checked as well. It's very important that you find an optometrist or somebody to do that eye assessment because your feet and your eyes can both show up some changes related to diabetes before they show up elsewhere in the system. Others will have an endocrinologist to assist on that medical management side of things, dietitians around some dietary advice, and then exercise physiologists are really playing an integral part in ensuring that people who are of low risk of diabetes foot complications stay of low risk. If you're not quite sure what an exercise physiologist does, it's a bit of a tricky one. They do different things for different people. They are exercise experts. They're there to match the right type of movements that you need to help you achieve your goals. So it might be more relating to blood sugar management, it might be around fat management, it might be around muscle building, it might be around bone density, it might be replacing medications with exercise. That's sort of the role of an exercise physiologist as part of a care team. Okay, so that's been low risk of complications. Hopefully now you've had a good chance to think about, all right, I've heard from a podiatrist I'm low risk, I've heard from whatever testing I've done that things are going okay there, I know how I'm going to look after things at home, washing, drying, moisturizing, I can manage my own toenails or I'll see my podiatrist for my toenails, I've got a good idea about my shoes, I've got to ramp up the physical activity or maintain my physical activity, and my care team are here for me. If you'd like to learn a little bit more about this, you can head over to prideplus.com.au. We've actually got a couple of videos about diabetes and feet that go into a little bit more detail around the sequelae, like what is actually happening around diabetes and feet. And we've got some other interactive things that you can have a play around with. I hope this has been really helpful for you. All the best.